The 9 months long siege and the systematic destruction of health facilities in Tigray by the Ethiopian forces and its allies has devastated the healthcare system in the region. As a result, the prevalence of coronavirus in Mekelle, the capital of Tigray, has increased highly. Dr. Harnet Adana, coordinator of coronavirus prevention at Tigray Bureau of Health, spread of COVID-19 in Mekelle has shown a 40% rise due to lack of medical supplies that stem from the ongoing siege.
After the conflict, more than 3,600 people were tested positive for coronavirus only in Mekelle. So far, 32 patients have died, and this is only in Mekelle. We couldn't cover other parts of the region as we have run out of basic supplies like fuel due to the siege. Before the war, the spread of coronavirus in Tigray was less than 1%, but after the conflict, it rose by 40%. Especially in the months of January and February, the spread has spiked to 70% in the city.
Dr. Guito Maraya, a medical doctor from coronavirus at Mekelle General Hospital, said that the hospital is losing its patients each day from treatable diseases due to lack of medical supplies.
In every day, we have been losing too much patients that could easily be salvaged if there was a medication, and the lack of medicine and other medical equipments were in a very problematic state.
According to Dr. Guiton, patients whose tests came in positive are unable to get treatments in both governmental hospitals and in private clinics due to lack of banking services in Tigray.
For instance, when we see the issue in COVID, the incidence was rising, there was no medication, there was no adequate personal protective equipment, and so on. Because of all those hindrances, we had been suffering too much. For instance, to treat one patient who is with COVID, severe COVID case, it demands around 1,200 birr daily, which is around $25 daily, and you can imagine how many of them can afford this much, while there is no functional bank. So it was very hard. We were crying together with our patients, but we cannot do anything beyond that.
Dr. Guitom also said that the mortality rate of COVID-19 patients has currently risen to around 21% in Mekelle General Hospital alone.
Actually, it is very difficult to explain it correctly because we have no appropriate testing kits. There are no deployed personnel focusing on testing the case, but based on the data I have, by the testing information we have in our hospital, it suggests that the case is dramatically rising. We are losing a lot of patients, and for instance, if you ask me the situation of those admitted in our hospital, we are somehow carrying admitted cases, and when we calculate it, there is around 21% fatality rate in our hospital from all the admitted COVID cases.
Dr. Guitom has called on the international community, saying that they should put the right amount of pressure on the Ethiopian government into making it open humanitarian corridors into Tigray and to end the man-made humanitarian catastrophe.
I suggest to the international community and humanitarian organizations to pressurize on allowing prompt unlimited humanitarian access and to end the man-made humanitarian catastrophe.
According to a recent research of Ghent University at Belgium, the number of deaths in Tigray due to lack of medical supplies after the siege has reached 32 per 1,000.